Hello YouTube, I'm Dr. Fox. Today, I would like to think about this situation. I am a teenager and I'm pregnant. What do I do? Becoming pregnant is very challenging for any teenager and they will need help from family to cope. Choices include going ahead and keeping the baby, as well as adoption or an abortion, though some will choose these latter options. This decision is a difficult one, and there is no right or wrong choice. You need to do what is right for you in your situation at this time. So, if you are going to have and keep the baby, what's next? When you have made your mind up, the first priority is obtaining prenatal support to safeguard your baby's health. The medical attention you receive will be the same quality as anyone else, including a wide range of tests such as ultrasounds, blood work, diabetes, and infection screening. You will also be advised on diet, what to avoid such as smoke and alcohol, as well as taking folic acid. There may be certain local programs in your area for pregnant teenagers that you can attend, so be sure to check online or in your local directory for support groups. Your medical professional can also advise. Okay, there are some crucial things to consider. The first thing would be education. Keep going to school as much as possible or an alternative source of education. Keep your daily routine and circle of friends will help you through any anxiety and shut yourself away from any negativity. Ideally, keeping in touch with the baby's father, whether your partner or not, will help in getting to grips with the many pressures and challenges up ahead. There will be other teenagers going through the same as you, so look for ways to share the experience with others rather than feeling alone with your problems. The next thing is birth control method. Decide upon which birth control method you will prefer once the baby is born. Another thing to consider is childcare. Check available childcare options in your area, including their accessibility and any expenses. Different communities will have different schemes available, but you won't benefit from them by not checking them out. Okay, next. If you are giving up the baby for adoption, make sure you fully understand what the options are rather than being railroaded. There may also be the possibility of counseling for any anxiety or guilt you feel. Alternatively, if you have chosen to have an abortion, then your health still needs to be safeguarded during the experience. Get advice on the experience and living with an abortion before you make the decision. Surround yourself with positive role models as much as possible, including loved ones and medical professionals. Social workers can also prove vital at this time, as well as various therapists. Okay, it's time to become more mature and start planning your life better. Having a child as a teenager tends to disrupt education. Teen mothers are less likely to graduate from high school and to attend college, more likely to live in poverty and at risk of domestic violence. However, if you remain robust in your life decisions and aims, then you can safeguard yourself from falling into poverty or worse. It is also the case that children of teen parents are more likely to have health and learning impairment conditions and are more likely to be neglected or abused. Girls born to teen parents are more likely to experience teenage pregnancy themselves. If you decide to keep the baby, then do so without avoiding any of these challenges you will face. Seek advice and guidance from professionals and other role models in your life, while look for any social benefits that will remain in school and support bringing up your child. Parenting classes can make a great contribution to your motherhood knowledge base. Consult the medical teams at your disposal along the way. While some may from teenage mothers, this is not the job of healthcare professionals, and you deserve as much help and attention as any other mother.